Assalamu alaikum. Good morning. We will continue what we have started yesterday about meningitis, bacterial meningitis, and we have spoken about three microbes yesterday, and today we will continue with the others. Today we'll start with Streptococcus pneumoniae, and sometimes the old name called pneumococci or pneumococcus for single. So Streptococcus pneumoniae is a gram-positive oval diplococci. Yesterday we have spoken about Neisseria meningitis and we said also diplococci. But Neisseria meningitis, we said the flat surfaces longitudinally opposite each other. But here, end to end, horizontally, the diplococci between the cocci end to end, not facing each other. And we will see that in the picture. The colonies appear green in color and zone around them. This is due to alpha hemolysis. That is to say, partial hemolysis. Alpha hemolysis means partial hemolysis caused by the microorganism, and we will explain why these microorganisms can cause partial hemolysis. They are aerobic microorganisms, and you should remember this. The capsule, also this microorganism is capsulated, and you have to remember that Streptococcus is capsulated microorganism. It has polysaccharide capsule, and the polysaccharide capsule can be serotype, and we have about 100, more than 90, about 100 serotypes of this microorganism. This microorganism characterized by having proteins called choline binding proteins. The choline binding proteins make the microorganism attach to the host. So choline binding proteins are attachment molecules to the host. This microorganism has got also an enzyme which can make pores in the host cells. This enzyme called pneumolysine, and it is released from the microorganism by the action of autolysine, which is present in the cell wall. يعني الأوتولايسين يسبب الريليس تبع النيمولايسين. النيمولايسين يعمل ثقوب بالخلايا الهوست الانفكتد. So this pneumolysine also can cause pores in the RBC during culture and cause the alpha hemolysis. The polysaccharide capsule is a virulent factor. And you know, the polysaccharide capsule can prevent phagocytosis, can interfere with the complement activation. So the capsulated microorganisms are virulent microorganisms. The non-capsulated are avirulent, not virulent, that is to say. Also, the polysaccharide capsule can block C3b of the alternative complement pathway and interfere with the function of the complement and escape from destruction by the complement by their capsule. This is a gram stain of pneumococci. You can see diplococci end to end. A microorganism arranged end to end, and there is a halo around them. This is the capsule. You can see that. This is very characteristic. I would like you to know this shape and characteristic of a gram stem of Streptococcus pneumoniae. Pneumococcal meningitis, our subject is CNS. This microorganism is able to cause acute purulent meningitis, purulent with pus. Usually, the meningitis follows other pneumococcal infection, for example, pneumococcal pneumonia. Sometimes, sometimes it is without a previous infection. There is no antecedent infection, يعني no preceding infection. It comes directly to the meninges from the site of infection. For example, it can come from a trauma. If there is a trauma to the skull, for example, or surgery in the base of the skull, surgery in the nose, and so forth, the meningococci may enter into the meninges. The sequelae of meningitis of Streptococcus pneumoniae is usually higher than other pathogens that cause meningitis. So we have to use the appropriate antibiotic urgently, promptly, because of the complications that can occur from pneumococci when causing meningitis. This is the clinical capsule of this microorganism. It can cause many infections, starting with pneumonia, and from localized infection, this microorganism will spread. Today, we are not speaking about respiratory tract to talk about pneumonia, but Streptococcus pneumoniae is one of the important causes of lobar pneumonia. 95% of lobar pneumonia are caused by Streptococcus pneumoniae, and from there, they can invade to the bloodstream and reach to the central nervous system and cause purulent meningitis. Their capsule will prevent their phagocytosis and destruction by the complement, so they can escape to the blood and cause meningitis. Also, they can cause otitis media, التهاب الأذن الوسطى, which is sometimes called hot ear. From the hot ear, it can spread to the meninges also. Sometimes sinusitis, also caused by Streptococcus pneumonia, and from there, it will escape to the blood and cause meningitis. How we diagnose it? As others, as yesterday mentioned, gram staining of the CSF, culture. And you remember the table. I would like you to go back to the table and see that these microorganisms are optokine sensitive. Some people, I said, pronounce it optocine, or they are bile soluble. It says very important, these two tests, to differentiate it from viridans streptococci. Why viridans streptococci? Because viridans streptococci also alpha hemolytic. So we have to differentiate it from viridans group of streptococci by optokine and bile solubility test. There is a reaction or test called a Qualling test or Qualling reaction, which is capsule swelling test. When you put a specific antibody against the capsular material of the microorganism, anticapsular antibody, the capsule become swollen. Look at this. This is the bacteria. This is the swollen capsule around the microorganism. When you put anticapsular antibody specific to it, the capsule become swollen. This is called the Qualling reaction. Treatment, we said we should be prompt in a treatment, and we started as early as possible. We can use third generation cephalosporin like Ceftriaxone or Cefotaxime. If the MIC is more than 0.06 microgram per ml, we have to use high doses of plus vancomycin. Unless the MIC is less than 0.05, you can use ordinary doses of Ceftriaxone without vancomycin. But once the MIC is high one, you have to combine the third generation cephalosporin with vancomycin, taking in consideration that this microorganism could be resistant one. Also, penicillin can be used, but remember that 10 to 40% of the strains of Streptococcus pneumoniae are resistant to penicillin. So you cannot take the risk in case of meningitis and start with meningitis or start with penicillin, because many of them are resistant to penicillin. And this resistance is due to altered transpeptidation. Remember, altered transpeptidation. I am not saying other cause, like enzyme or something like that. The resistance to penicillin is due to altered transpeptidation of the cell wall. The transpeptidation يعني تكوين البeptidoglycan of the cell wall. Prevention, we have two types of vaccines. 13-valent pneumococcal conjugate, look to the word conjugate vaccine, PCV, and 23-valent pneumococcal polysaccharide vaccine, PPV. We said we have more than 90 serotypes of capsular material. يعني من الكابسولار serotypes 90 أو 100 reaching up to 100 نستعمل 13 واحد باللقاح الأول ونستعمل 23 واحد باللقاح الثاني. اللقاح الأول, which is 13-valent pneumococcal conjugate vaccine, is T-cell dependent vaccine. It can stimulate Th2 response, immune response, given from 2 months of age and on. In case of immunocompromised, it can be given from less than 5 years of age and on. The 23-valent pneumococcal capsule, which is PPV, it has added protection. ليش added protection؟ لأن 23 serotype. الأول كان 13. This vaccine is T-cell independent vaccine, يعني does not require the help of T-cells to stimulate the immune response. It is given from 2 years of age and on, because it requires mature body in order to produce T-cell independent immune response. While the first one, because it is T-cell dependent, so it can be given from 2 months of age and on. Remember this. So the first one can be given from 2 months. The second one can be given from 2 years on. The last microorganism that I am going to talk about causing meningitis is Listeria monocytogenes. Listeria monocytogenes is very special microorganism, and it has characteristics, unique characteristics, which you have to remember. These are gram-positive rods, bacilli, resemble Corynebacterium, especially the diphtheroids. It can cause beta hemolysis, catalase positive. And when we say catalase positive, you have to remember in the differential diagnosis, Staphylococcus, Streptococcus pyogenes, Streptococcus pyogenes, which are catalase negative. These are catalase positive. Streptococcus pyogene also beta hemolytic. So we have to differentiate between them, and Listeria is catalase positive, while Streptococcus pyogene or group A streptococci are negative for catalase. These microorganisms, I said, unique in their characteristic. They can grow at temperature below 0 degrees centigrade. Why can grow at this temperature? Because they have what we call RNA helicase enzyme, which will protect them from destruction in cold temperature. Therefore, these microorganisms are important in frozen food. Frozen food. Therefore, you can expect that the infection can come from frozen food, like cheese, for example, meat, etc. These microorganisms below 30 degrees centigrade in the fluid, they have very characteristic motility, which is called tumbling motility. What is tumbling motility? The microorganism goes backward, يعني ترجع إلى الوراء وليس إلى الأمام. This is called tumbling motility. Tumbling motility, it means that the microorganism is moving backwards. And this can differentiate it from Corynebacteria, which are non-motile bacilli, gram-positive, non-motile bacilli. So we have put two differential here, differential from Streptococcus pyogenes by catalase, and differential from Corynebacterium, which are gram-positive bacilli also by the tumbling motility. This microorganism has a factor of virulence, which is called internaline. It is for attachment and invasion of the host cells. Also, they have got an enzyme called listeariosine O. It is listeria, so this enzyme is called listeariosine. This listeariosine O can cause pores in the infected cells. So it is spore-forming cytotoxin. يعمل ثقوب بالخلايا الانفected. So remember, internaline and listeariolysine O, LLO. So you can see the microorganism motile, rod, comes from food, and it can be cultivated. This is the gram stain of it, gram-positive. Sometimes they describe it arranged in Chinese letter-like, similar to Corynebacterium. Pathogenesis, they can grow in macrophages, non-immune macrophages. The invasion of host cells can be done by surface protein and internaline. And also this microorganism have the capability of crossing the placental blood barrier. This is very important characteristic. So if the mother becomes infected from food and the microorganism goes through the intestine to the blood, this microorganism may reach to the fetus and causes fetal infection. They can escape from the phagosomes in the phagocytic cells and go to the cytoplasm by the capability of listeariolysine O, which can break down the vacuoles around the microorganism. These microorganisms have the capability of using the actin threads of the cells. Actin, is part of the cytoskeleton. Actin, it has the capability of actin polymerization and can form for them tail. This tail is called comet tail. So comet tail is formed by actin polymerization of the cytoskeleton of infected cells. With this tail, they acquire the characteristic of tumbling motility, الرجوع إلى الوراء. These microorganisms are common, can cause infections common under 1 month of age, so it is very important in the early days of life, and also susceptible individuals after the age of 60 years. You can see that with the internaline attached to the host cells and invade the host cells, and in the phagocytic cells or in the infected cells, they can form vacuole around them. But with the listeriolysin O, this microorganism can escape from the vacuole and goes to the cell here in the middle, and using the cytoskeleton filaments. These are the cytoskeleton filaments, and cause actin polymerization and form the comet tail. هذا هو الcomet tail, the yellow one, by which it can move backwards. This microorganism have the capability of going horizontally between the cells. It can invade the adjacent cell here and goes into double vacuole. But again, with the listeriolysin, this microorganism can break through the vacuole and go again free in the cytoplasm and go and invade other cells. And then go to the submucosa, and in the submucosa, they can invade the blood stream and cause meningitis. So, as I said, it can come from food, a drink or food. This is cheese, this is meat, water, etc. And can go from the intestine to the blood, as we have seen. And if it goes to the blood, it can come to the meninges. It can reach to the meninges and cause meningitis. And if the mother is pregnant, it can also reach to the fetus and cause neonatal listeriosis. Listeria, the infection is called listeriosis after the birth of the child immediately. The meningitis of Listeria monocytogene, this microorganism has a tropism to the CNS, like to go to the CNS tissue, including the brain parenchyma, and cause also encephalitis. So this microorganism can cause meningitis and can cause encephalitis. And their bacteremia can be described sometimes as occult bacteremia. What is the meaning of occult bacteremia? Insidious, without obvious manifestation. كأنما لا يوجد شيء. This is called occult bacteremia. This microorganism cannot be distinguished clinically from other bacteria which cause meningitis. But this microorganism, as I said, it has insidious growth. يعني بطيء نوعا ما الجروث تبعها. مو زي البقية مثلا within 24 hours can kill the patient. So this microorganism does not have high mortality rate. The clinical capsule, you can see listeriosis is insidious infection in a human. It can infect fetus. It can infect a newborn baby and can cause stillbirth. Stillbirth يعني موت الجنين وهو شبه كامل at the end of the pregnancy. It's different from the word abortion. Stillbirth, when the fetus is mature enough at the end of the pregnancy, when there is death of the child, and abortion is called stillbirth. Also can cause fulminant neonatal sepsis. So you have to keep an eye on the child in the first few days of life, and you should remember together with group B streptococci. You remember we said in the first few days of life can cause meningitis. Again, this microorganism, you have to remember it in age group below 1 month of age. In adult, when the infection occur, usually there is only general manifestation. We said occult bacteremia. Only general manifestation, no specific thing like fever, malaise, associated with eventually you can trace this manifestation to the occult bacteremia. انت ما تعرف بالبدايه انه هذا الشخص عنده بكتيريميا لانه ما ظاهره عليه علامات البكتيريميا اللي نعرفها كلاسيكلي، بس من تعمل كلتشر راح تشوف انه المريض تاعك عنده بكتيريميا. Immunity, both innate and adaptive immunity, that is to say specific and non-specific immunity, are important. The toll-like receptor recognize the peptidoglycan of this microorganism, and the body can mount CD4 positive and CD8 positive cells against immune response against this microorganism. And if the patient is deficient in these cells, like in case of AIDS or HIV infection, deficient in CD4, that is why infection with Listeria monocytogenes is increased in AIDS and in immunocompromised patients because they have defective cell-mediated immunity. Diagnosis, again, as other microorganisms, CSF, you can do gram staining. Culture on a blood agar, we said beta hemolytic. And if you do gram stain from the colonies, you will find them a gram-positive bacilli or rods. Treatment. Remember, in a treatment for Listeria, ampicillin. Always remember ampicillin. The first drug, the drug of choice, I can say to you, against Listeria monocytogenes is ampicillin. So you can use ampicillin together with gentamicin. You know, there is synergism between ampicillin and gentamicin, and this combination can be used in fulminating cases. Alternative, if the patient is allergic to penicillin, you can use cotrimoxazole. Unfortunately, there is no vaccine available against this microorganism. Remember, there is no vaccine. Lastly, I will talk about this table, which is very important table. It's the cornerstone in the diagnosis of meningitis. Every one of you should master this table. This table is not a table like a table only. It's a text-like. This is the general CSF examination. We are going to talk about the test and appearance of the CSF, the intracranial pressure, white BC count, protein in milligram per deciliter of the CSF, glucose in milligram per deciliter, and the chloride content. So if we take the normal CSF, it's clear, very clear, transparent. The intracranial pressure in normal individual is 90 to 180 millimeter. White BC, lymphocyte, as lymphocyte, 0 to 8. Only lymphocyte, no neutrophils. Neutrophils here indication of bacterial infection. The protein level, 15 to 45 milligram per deciliter. Glucose, 50 to 80 milligram per deciliter. And the chloride, 115 to 130 milli equivalent per liter. So if we come to acute bacterial meningitis, زي اللي حكيناه بهاي المحاضرتين، شو توقعنا عن السي اس اف؟ the CSF will be turbid. The intracranial pressure is increased. White BC, mainly neutrophils, because it is bacterial infection. And sometimes when you see a lot of neutrophils, this is an indication for bacterial infection, acute bacterial infection. Usually they reach 1,000 to 10,000 per microliter. The protein, because the bacteria are protein containing protein material, so the protein level will be increased. It can reach to 100 to 500 milligram per deciliter. Because the microorganism uses the glucose for their nutrition, so the glucose level will decrease. Usually the glucose in acute bacterial meningitis less than 40. And the chloride again is also decreased. Next lecture inshallah عندنا viral meningitis, and I will speak about the profile of viral meningitis to prepare you for next lecture inshallah. In the case of viral meningitis, the CSF appear clear as if it is normal. The pressure is almost normal. Now you have mainly lymphocyte because it is viral infection. In viral infection, lymphocytes are increased. In bacterial infections, neutrophils are increased. Normally we have 0 to 8 lymphocytes, usually 1 or 2. But in case of viral meningitis, they reach 5 to 300. Rarely they exceed 1,000. Protein normal. The viruses do not have a lot of protein to cause an increase in the protein. Maybe mild increase, but usually normal. Glucose normal. And chloride is normal. TB, Mycobacterium tuberculosis, also can cause meningitis. And the appearance characterized by being slightly opaque and cobweb formation زي بيت العنكبوت يحصل فيه وراح نشوفها إن شاء الله في صورة. The pressure could be increased depending on the spinal canal block or not. The white BC mixed. What is the meaning of mixed? يعني neutrophils and lymphocyte. May reach to 100 to 600. Protein also increased, 50 to 300 due to spinal block. Glucose, because the microorganism uses also glucose decrease and the chloride decrease. Fungal infection like a cryptococcal fungal infection, a clear, pressure increased, also mixed, 40 to 400. Protein is 50 to 300, glucose decreased. Acute syphilitic, in syphilis, in case of syphilis, a clear, pressure increased, lymphocyte you have, about 500 lymphocyte. The proteins increased, but usually less than 100 milligram per deciliter, glucose normal and chloride normal. You can look at this table and make for you notes to remember and memorize this table. Very important table. It is very useful to you now and then when you go to the clinical site. Very important. And also we will talk about the same table next lecture, inshallah. But for the time being, remember acute bacterial meningitis, because these two lectures were on acute bacterial meningitis. Next lecture, we will talk about viral meningitis and others. Any question? Any comment?
دكتور
نعم.
يعطيك العافية. الابيرنس للسيربروسباينال فلويد بيكون اعتماد يعني على البص، وجود البص لهيك بكون تيربت.
يعني احنا من نعمل CSF اذا فهمت السؤال تبعك. من نعمل CSF examination, general examination. We are going to look for the number of white BC. Number of white BC, it means the pus cells. Okay, so you see whether you have got a neutrophils, which are the pus cells, or lymphocyte, or mixture of both lymphocyte and the neutrophils. If it is mainly neutrophils, it is bacterial meningitis. If it is mainly lymphocyte, it could be the others as I described.
دكتور بقصد الابيرنس، لو ترجع الجدول
نعم
اول كولون
نعم
مكتوب تيربد.
تيربد يعني متعكر ليش؟ لسبب وجود البكتيريا، وثانيا لوجود أعداد كبيرة من النيوتروفيلز which are the pus cells. يعني متعكر من المايكرو أورجانيزم اللي موجودة بالسي اس اف، ومتعكر من عدد النيوتروفيلز الكبير جدا، يصل إلى 10,000 نيوتروفيلز لكل مايكروليتر. فيصبح عندك تيربد. يعني is one of the characteristic that once you see turbid CSF you have to think about acute bacterial meningitis.
تمام، يعطيك العافية دكتور.
تمام عيني.
دكتور
نعم
عندي سؤال بالستريبتوكوكس نيمونيا، هل هي
نعم.
كبسول ولا نون كابسوليتد؟ لأنه في جزئية فيها مكتوب نون كابسوليتد وحكينا عنها ايفرولنت، ما فهمتها، يعني هي كابسوليتد ولا نون كابسوليتد؟
الستريبتوكوكس نيموني
هي هاي
طبعا كابسوليتد،
طب
وذكرنا
إيش
أول
الجزئية
إشي
هاي؟
كبسول. هذه ستريبتوكوكس نيموني capsule which is of more than 90 serotypes. And the polysaccharide capsule, look here on the slide, the polysaccharide capsule is a virulent factor. The non-capsulated, there are variants. The non-capsulated are avirulent, not pathogenic. So only the capsulated are the pathogenic, and you have seen it in the gram stain. The halo around the microorganism is the capsule, and also in a Qualling reaction, this is the bacterium, this is the swollen capsule. Clear? يعني any microorganism of Streptococcus pneumoniae variants which are not capsulated are avirulent microorganism, cannot cause disease, because the capsule is part of the virulence, ضراوة يعني الvirulence ضراوة pathogenicity of the microorganism. الستريبتوكوكس نيموني اللي ما فيها كبسول cannot cause disease, avirulent. واضح؟
وصلت دكتور.
تمام يعني. بعد مين عنده سؤال؟ أسئلتكم حلوة ممتازة.
دكتور هسه هون الستريبتوكوكس نيمونيا محطوط end to end، وحكينا المننجيتايتس بتكون opposite to each other.
end to end. شوف هسه أشرح لك إياه. end to end هتشوف الكوكاي oval in shape, they are oval diplococci end to end. صح؟ معاي بالصورة؟ يعني كأنما horizontally، يعني these microorganisms arranged horizontally. If we go back to the first lecture about Neisseria, we can see a different shape, although they are diplococci, but they are usually face to face like that. Longitudinally, they face each other longitudinally, زي الكدني shape or bean shape، حبة الفاصوليا. هذا هو المقصود بالشيب. وهذول جرام نيجاتيف النيسيريا، بينما ستريبتوكوكس نيموني جرام بوزيتيف. واضح؟
واضح دكتور، شكرا.
أهلا وسهلا. Any other question? Please ask. Still we have some time. If there is no questions, I have to stop here, and I hope to see you next lecture, inshallah. Assalamu alaikum.